This is a case of Uret-Zavalia syndrome that is characterized by a persistently dilated pupil that does not respond to topical miotics. The pupil remains in the dilated position, and over a period of time, it leads to raised intraocular pressure because of the formation of the peripheral anterior synechia. Now, this situation many times goes undiagnosed by the surgeons. The only clinical thing that is needed to be done in this case is to close down the pupil because it is persistently dilated, and this persistently dilated state leads to further problems in the eye. Hence, in this case, typically, the patient had undergone a cataract surgery. The vision was absolutely normal for this patient, but the patient had raised intraocular pressure and the patient had a lot of glare and photophobia because of the persistently dilated pupil, and this patient was a very unhappy patient even though the cataract surgery was absolutely normal. Now in this case, what I'm doing is I'm trying to close down the pupil from both the quadrants, from the superior and the inferior side, so that the iris tissue comes back to its normal position. Single pass 4-through pupilloplasty procedure is being done here, wherein a ninopolypropylene suture is taken. It approximates the proximal and the distal iris defect, and the suture loop is now withdrawn, and the end of the suture is passed through the loop 4 times. It is not necessary for the surgeon to pass more than 4 throws, but if you take less than 4 throws, the suture knot opens up, because in this method of pupilloplasty, there is no securing knot. It's just an approximating knot which remains in position if you take 4 throws. But when you're taking the throws, and if you forget the counting, it is always better to take 1 or 2 throws extra to give the benefit of doubt so that the suture does not open up. Having done this, when you pull both the suture ends, the knot beautifully slides inside and it approximates the iris tissue, and then you can use the end opening scissors to go inside and cut the suture knot. You can repeat this procedure till you are happy with the size and shape of the pupil that is achieved. Having done this surgical procedure, the intraocular pressure came down to normal, and the patient was quite a happy patient and never ever had photophobia. But the important thing is that this clinical condition needs to be diagnosed and pupilloplasty has to be done for this patient.